everyone. We'll begin shortly. The webinar starts at 10 a.m. this morning. And we had over 100 people registered, 150 people registered. So we will, I will allow 2 more minutes to allow individuals to log in so that they can hear the presentation from the beginning. So thank you for being patient with me, and we'll start at 10:02. Thank you. Good morning, everyone. We're going to start our webinar. I want to say again, good morning to everyone, and welcome to the CAPDA Renewal Waiver Orientation for our waiver participants and their caregivers. Today's session will focus on the goals and objectives of the renewal waiver for our program and any program updates pertaining to the renewal waiver and changes. My name is Rena Bratz-Brown. I'm the Waiver Operations Manager, and I administer the CAPDA waiver statewide. This webinar will be put in mute mode throughout the duration of this webinar. That will minimize the background noises for individuals participating by phone to allow you to better hear and understand the information I will be presenting to you today. If you have any comments or questions while I present the information today, feel free to enter that information in the question queue. You will see that here on the webinar. You can type your information into that area, and then at the end of the webinar or my presentation, I will address your questions or comments. When the webinar is over, when I finish my presentation, I will stop and address the questions. At that time, if you prefer to verbally state a comment or a question, you can always raise your hand. We will acknowledge your hand, unmute your lines, and allow you to ask a question or make a comment. This webinar is scheduled for 2 hours today, 10 a.m. to 12 noon. We may not need the full time to go over the information, but we will make a time available for you to process any questions that you may have. My goal today is to provide you a broad overview of the renewal waiver changes so that you'll understand any new requirement that you will see throughout the duration of the waiver cycle. Your case manager is being trained at the same time that you are receiving this information, and they will be able to provide you more detailed information about the new changes in the waiver. Today's conversation will not address any personal experiences. It will provide you updates and information about the new renewal waiver application. With that information, I will begin, and I hope everybody is able to see my slides. So today's engagement, my goal is to provide you a review of the program goals and objectives. What are the new goals for our waiver, and how will we get to those goals? I will identify program assurances, what things that we are required to do as a state of North Carolina Medicaid agency in order to provide this service statewide and to ensure the health, safety, and well-being of the participants that's receiving our waiver services. I will describe program changes and new requirements. Again, when I describe these program changes, it will be a broad overview, not detailed information. Your case manager will be able to provide you those detailed information as they are receiving training as well. I will describe home and community-based services to you, what those services are, and some of the limitations of those services. I will also provide for you our program participation years, meaning the date that the waiver becomes available and the length of time that we will be able to use the services within that our new waiver renewal. So when we look at our goals, we have two overarching goals. We have a requirement to ensure at all times the health, safety, and well-being of program participants. That means that we're going to ensure that we complete a thorough assessment of your needs, create a service plan to meet those needs that we have identified, and then create a monitoring schedule to ensure that your health, safety, and well-being is being safeguarded while you are receiving our waiver services. We will ensure at all times that applicants, individuals who are seeking our services, and active participants, individuals who are actively receiving our services, they have reasonable indication to use our services, meaning that we have determined that based on your risk factors, your needs, that you have a reasonable need to receive our home and community-based services to maintain your community placement. Now, our objective through this process to reach our goals is to do regular assessments of your service plan through scheduled monitoring contacts. That means that your case manager will consistently monitor your service plan through scheduled monitoring contacts. That can be by phone, that can be by person, or face-to-face. So when we look at our waiver renewal, we have to have some assurances, meaning that there must be things in place that we can ensure that we're safeguarding the health, safety, and well-being of our participants in our waiver. So we call that quality assurance. And basically what that means is an oversight. We have a process to oversee the health, safety, and well-being of our beneficiaries through a continuous cycle that captures, monitors, and measures core areas to discover any defects, non-compliance, outliers, and anomalies. I know that was a lot. So what that basically means is that we have systems in place. We have our assessment. We have a service request form. We have a service plan. We have monitoring tools to determine how the safeguarding of our beneficiaries. And those tools that we use, we are constantly looking at those tools, constantly pulling data from those tools to determine or to discover any defects to ensure that we are providing for the health, safety, and well-being. So when we do that on a continuous basis, we're aiming to discover things that are not working right. And then our goal is to correct those things that are not working right. And then that leads for us and to the beneficiary a quality improvement, your satisfaction in receiving the services to meet your needs and your loved one's needs. So why is this important? It is important because it provides a protection for you and ensures your protection and safety while you are accessing our home and community-based services. And in our program assurances, we have 6 overarching things that we have to ensure on a regular basis. And that first thing we call is assurance. It is assurance number 1. And we call that level of care. And level of care is one of our eligibility requirements to enter into our waiver. In order to be considered eligible or clinically eligible to come into our waiver, the participant must meet a level of care that is consistent with institutional or nursing facility level of care. That indicates that your needs are severe, where you need home and community-based or coordinated services to maintain your community placement. So in the level of care assurances is what we have to do. We have to create and design a consistent process and an instrument to measure or evaluate and reevaluate your level of care to ensure your needs are consistent with individuals who are in an institutional placement or a nursing facility. That means that you have limitations in areas, you have a chronic disability, physical limitations that requires coordinated services, hands-on services and case management to ensure you are integrated in the community. Our second assurance we call is a service plan, and that is a system that we use to address your assessed needs. So once we complete a assessment, so we ask you a lot of questions and we gather your health information, your functional information, your caregiver information, and we use that information to identify what your risk factors are. And from there, we create a service plan. And the service plan is used to address your health and safety needs through your personal goals that are listed out in services, the types of services you need, in the amount, frequency, and duration, such as in-home aid, adult day health, and we list that out in a service plan to ensure your needs in the community are met. Our third assurance we call is a qualified provider, and that is where we constantly determine the provider that's going to provide your services, such as your in-home aid or personal care, that provider is certified and meet all the requirements that they need to meet in order to be able to render you that service. So they are completely qualified and knows how to meet your needs. The fourth assurance that we look at is health and welfare. And health and welfare is an effective management system or process we use to protect your health, safety, and well-being, to ensure that you are safe in the community and you are safeguarded against abuse, neglect, and exploitation. Our fifth assurance is financial accountability, and that just basically means for you as a waiver participant that we have a system in place to ensure the providers who are rendering your services are paid to render those services so that you are safe in the community, so that we know that they are being reimbursed for the time that they are providing a service to you. And our sixth assurance is what we call administrative authority. And that is that the state of North Carolina, the Medicaid Department, has ultimate administrative authority and responsibility. That means that we are assuring the operations of the waiver by exercising oversight of the performance of the waiver function that is carried out by your case managers, by your direct service providers, and other entities that are assisting us in administering the waiver statewide. So those are our basic assurances, and I wanted you all to hear that so that you can have an understanding of the things that we have to ensure on an ongoing basis to protect your health, safety, and well-being and your satisfaction while participating in our waiver program. So I'm going to shift a little bit and talk about some of the program acronyms. So when you participate in our waiver, you may hear your case manager refer to certain acronym, or you may see it on paper, or if you call out my office, you may hear us say that. So some of the acronym that you may begin to see, or you may already see, is ANA, and that's abuse and neglect. That's what we call, and that's one of the areas that we have to ensure. You may see an acronym CME, and that's a case management entity. CNR, that's your continued need review, your annual reassessment. DSB, and that's a direct service provider, your provider who's providing your waiver service. You may hear your case manager talk about the ECAP system. That is where we put all your CAP information, like your assessment, your service plan, your monitoring information. You may hear us talk about freedom of choice, where you have the choice to select any provider to provide your care. You may see the acronym GS, which is Goods and Services, some of our waiver services, HSW, Health, Safety, and Wellbeing, HCBS, Home and Community-Based Services, MDT, Multidisciplinary Services, IAE, Independent Assessment Entity, PG, Performance Goals, PM, Performance Measures, POC, Plan of Care, QP, Qualified Providers, SMA, State Medicaid Agency, and SP, Service Plan. So those are just a few of the acronyms you will begin seeing, or you may be familiar with. You will see some of these acronyms as I go through this presentation today. I just want to bring that to your attention. And I also want to bring to your attention program terms that you may begin hearing us refer to and that you may see throughout this presentation. Applicant. Applicant is just a person who's seeking for the first time our waiver services or entering into our CAP program. Beneficiary is what we use for individuals who are receiving Medicaid funding or who are receiving Medicaid. Participant, you may see that throughout the presentation, where a participant for this particular situation is an individual who is enrolled in our waiver, and we refer to that as a waiver participant. You will begin hearing us talk about 90-day service plans, incident reports, self-assessment questionnaire, background checks, employer of record, root cause analysis, multidisciplinary treatment team meeting, contact visits, competency validation, quarterly competency validation, and qualified providers. So those are some of the terms you will begin hearing us talk about, and you will hear throughout my presentation today. So what I will provide to you today is program changes. I will provide you a broad overview of enrollment in the waiver. What are the requirements now for enrollment in the waiver? What is the service plan development process now? And how will health, safety, and well-being be managed? What are your rights and responsibilities as a waiver participant? And then what is consumer direction and how an individual is eligible for consumer direction? All right, so enrollment in the waiver. And I broke it out into new applicant and active participant. So at the beginning, I talked about an applicant. An applicant is a person who's seeking our services for the very first time. And an active participant is a person who's already enrolled in our waiver and going through their annual reassessment, the CNR. For a new applicant, in order for them to begin the process, they must sign a consent form, giving consent to the case manager or the independent assessment entity approval to begin gathering their health care information to complete a service request form. So that's one of the new changes. So you have to sign your consent first, and then we will begin gathering the health information to determine your clinical eligibility to enter into this waiver. That only applies to new applicants. Then, once the consent form is signed, a service request form is initiated. And the service request form is the information that collects all your healthcare information. And then that service request form is sent to your doctor for your doctor to attest to it. And once the doctor attests to the form, saying that yes, your needs are consistent with needs of individuals in a nursing facility or a level of care, then that information is processed and entered into into the ECAP system for a decision if you are at the clinical eligibility requirement. Once that is completed and there is an approval that you have met the clinical eligibility, then an assessment is completed. An assessment is completed to identify risk factors to determine need for community-based services. That means that once someone goes out to your home, the nurse will then review or ask you a lot of questions, may ask you to show them how you do certain things or complete your activities of daily living. And then they determine, based on the information that they witnessed, the information that was provided to them, if you are in need for at least one of our waiver services, which determines that there's a reasonable indication that you need our services. Once that is completed, you will receive a program disclosure letter. And a program disclosure letter just provides information about what the waiver is, what services are available, and how you will access certain things. And will also provide you key contact information while you go through that process. A new applicant will also receive a decision letter to inform them the decision of what occurred at the service request and the assessment, what the decision was yield. And in this process, the applicant must apply for Medicaid if they are not already eligible for Medicaid. And if they are eligible for Medicaid, they must notify their Medicaid worker that they are interested in participating in the CAP-DA's program, meaning that they are going through the application process for CAP. If you are approved to participate in CAP, one of the new requirements is you must sign a program agreement letter saying that I agree to participate in the CAP-DA's program in order for your service plan to begin or be initiated. And then you will also sign a freedom of choice form to select a case management entity to begin to develop your service plan. That's for new applicants to be able to enroll in our waiver. So for applicants or participants who are already in our waiver program, what you will do and what you may see differently in this process is when your annual assessment is due, you will sign a freedom of choice agreement form allowing your case manager to begin to do your assessment. They're saying, yes, I continue to want my case manager to do my assessment. The case manager will then complete the reassessment to determine if you continue to meet a level of care. So they will come to your home. They will do that comprehensive assessment that I just talked about, where they will ask you a lot of questions. They may ask you to demonstrate how you complete your activities of daily living, your instrumental activities of daily living. They will talk with your service providers, your physician, to get the information they need in order to complete the assessment. They will do the reassessment, and the reassessment will identify if you continue to need home and community-based service, if you continue to need at least one home and community-based service. Turn my phone off. All right, sorry, I had to turn my phone off. You will also receive now a program disclosure letter. Even if you're participating in the waiver, on an annual basis, when it's time for your renewal, when you have to have your information reassessed, you will also receive a disclosure letter. And the disclosure letter will inform you about the waiver requirements, what is required to participate, what things that we look at, and additional contact numbers for you to have. You will also receive a program decision letter to inform you of the decision that was made from the completion of your reassessment. You will also have to recertify for Medicaid when applicable. So your Medicaid worker, and that's not your CAP worker, but your Medicaid worker will inform you when it's necessary for you to recertify your Medicaid eligibility. So they'll let you know that. You will also have a program agreement letter that you will have to sign to say that, yes, I do want to continue to participate in the CAP program. So so after your 1 year or however long you've been participating in the waiver, when your reassessment comes up, we call that a CNR, your annual review, you will have to sign an agreement letter to say, yes, I want to continue to participate in the CAP program. And then you will sign a freedom of choice form identifying your providers to include your case management entity. And those are the providers that will render your services. So once you sign your program agreement form, and then you will, in your case management, select your case manager to complete, or management entity to complete your service development, then we go into this process of the service plan development and how that process works. Now, the process is very similar for new applicants and active participants. So I'll read those together. So when you are ready to do your service development or your service plan, you will sign a freedom of choice form for your case manager to start that service plan. So we talked about that. So you will sign that. Then your case manager will then have 2 days after you select that case manager. Now, if you're already participating in the waiver program, it can be your same case management agency. You will just sign, I want RENA Case Management Agency to continue to provide my case management. So they will then, at that point, once you sign that or select your case manager, they will have 2 days from that time to contact you. That doesn't mean they have 2 days to come to your home, but they have 2 days to contact you to arrange a time to visit you in order to start the development of your service plan. So when they get to your home, so once the appointment is scheduled, they come to your home, they will begin working with you to develop your service plan. They will assist you in identifying your goals, your likes, your dislikes, your cultural preferences, your beliefs, and other preferences of your care in order to include that in your plan. Now, when you're developing your plan, you can invite anyone you prefer to participate in the development of your plan. The case manager will provide to you a conflict of interest protection form, and that conflict of interest protection form will inform you what your rights, your protections as a beneficiary, and how the case manager will ensure that there's no influence while you create your service plan and select your providers to render your services. You will also provide to the case manager a freedom of choice form, and that's the form to select, that you will select the providers you want to render your services. So if you're receiving in-home aid, you will select the in-home aid provider or home health provider. If you're approved to receive adult day health, you will then select an adult day health provider. So you will then willingly select the providers of your choice to render your care. Once the service plan is completed, you will sign off on the service plan, meaning you will sign the service plan agreeing to the services listed on the service plan in the amount, frequency, and duration of the services that you and your case manager were able to come to agreement with. You will also sign a rights and responsibility form, and that indicates that you have been provided information about your rights and your responsibility while you are participating in the program. And you will also agree to a monthly and a quarterly contact visits. So the case manager will work with you to develop a visiting or a contact schedule that you all will agree to. So you are required to have a monthly contact with the case manager by face or by phone, and you must have a face-to-face quarterly visit with your case manager in your home. And that will be an agreement that you all will come to about the dates and the times in which you all are planning to meet going forward after your service plan is completed. So when we think of when your service plan is completed, services are then authorized and is approved. So once you sign your service plan, that means your service plan is approved, that you can begin receiving your services. So the case manager at that point then enters that information in our ECAP system, and then that information is processed through our ECAP system. And the providers that you selected to provide your care, they are sent a service reauthorization form. And then they have to accept that service authorization form in order for the services to begin. So they will accept that service authorization form, and we say within 3 days they need to acknowledge that service authorization form. And acknowledge means they can accept it or they can reject it. That's their choice. And then once they accept that service authorization, they must contact you within a reasonable amount of time, within 5 business days, in order to begin discussing your care plan. And that is a plan that they will create based on your service plan in order to manage your needs. So if you had in-home aid service on your service plan, your home health agency will create a care plan to carry out those things that you need, provided those hands-on services. Within 15 calendar days, your services should start. So that's the maximum, but we're saying they should not go over those 15 calendar days. And then 1 month after your service plan is created or approved, your case manager will monitor the services that you're receiving to make sure that they continue to meet your needs and that you are safe using those services and you can maintain your community placement. So when we look at service plan development, in a previous slide I talked about qualified providers, that we have to ensure that the providers that are rendering your services are certified, are licensed, they're completely qualified to render those services to you. We have listed out who are qualified providers for our waiver services. So if you are approved to receive adult day health services, then an adult day health organization must be a certified adult day health provider, meaning that they must have went through some kind of certification, passed that certification, and have a certificate to render that service. If you receive CAP in-home aid services, that provider must be licensed by the state of North Carolina as an in-home aid agency or a home health agency. If you're receiving any equipment modification or technology, watch this doing this. The provider must be a certified durable medical equipment supplier, and you may see the acronym DME, or a retail provider. So they must have a license or certification in order to render that service. Or it could be your case management entity. They can authorize a provider to render that service and then and reimburse that provider. If you're receiving meals preparation and delivery, The provider that you select must be a certified meal preparation provider. So they must have met all the qualifications to provide those meals. Same with respite, must be a licensed in-home aid agency. If you're receiving personal emergency response services, it must be a certified emergency responder organization. Financial management, if you're participating in consumer direction, your financial manager must meet all the requirements set forth by the IRS guidelines. Case management agencies are designated by North Carolina Medicaid, where we look at their credentials, their qualifications, their staffing, and determine if they meet the basic requirements or qualifications to act in the role of case management entity. If you're receiving any specialized medical supplies, such as oral nutritional supplements or specialized incontinence supplies, it must be through a certified DME provider. Goods and services must be through a business or retail or a certified DME. Community transitions and integration services, the same applies. It must be through a certified DME organization or through a retail or business organization. Same with training, education, and consultative services. Must be through a business or retail organization. One of our new services, coordinated caregiving, NC Medicaid will designate the provider to render that service. And then a personal assistance services, that's if you're consumer directing, must be a non-licensed, non-certified individual who is able to pass a background check and who meets the competency validations. So I wanted you to understand who are qualified, entities that are qualified to render your services. So when you're selecting a provider, that you're selecting a provider that is qualified to render those services. So when we look at service plan development, we have some new requirements. And you may be familiar with some of these requirements, but we've made some changes to these requirements. And one of the requirements is our emergency and disaster plan. You may remember that as our emergency backup plan. But in this new waiver, we will refer to it as emergency and disaster plan. That is a plan that you must create annually and must be updated 2 times per year. And it will list out who are your emergency contacts. If something happens to you and your primary caregiver, who is the person we need to call, your case manager? And it'll list out other things, and what is the emergency plan for those things. It would also have you to list out what happens or what is your preferences if there is a disaster in your community. If there's a hurricane, if there's an ice storm, if there's a fire, what is your disaster plan? Where is your safe place? Where is your prescriptions kept so that you can get those? What are your DME needs? If you have to go into a shelter, what shelter do you prefer? What special things need to be considered to ensure your health, safety, and well-being and your medical condition? That should be completed when your service plan is assigned and approved. If it's not completed, when your service plan is approved, when you sign off on your service plan, you will have 30 days from the date your service plan is approved in order to complete your emergency and disaster plan. If the emergency and disaster plan is not completed within 30 days of the approval of your service plan, on day 31, your services will be suspended until the emergency and disaster plan is completed. As I stated before, your emergency and disaster plan will be updated 2 times per year so that you can ensure that the emergency and disaster plan meets your needs as time goes on. When there's a critical incident and your needs changes, then your emergency and disaster plan will also be updated to now reflect your new needs. We have implemented something that's called a 90-day service plan. And a 90-day service plan is used for multiple reasons. It can be used for new individuals seeking enrollment in our waiver, and they only need some modifications to their home, such as a ramp, or need a lift for their car in terms of wheelchair or an adaptation or some kind of assistive technology. They can obtain that information within 90 days and can live safely in the community. Our 90-day service plan can also be used when there are concerns of health, safety, and well-being. And we create a safety plan for the beneficiary, and we will monitor that over 90 days. It can be also used when there are behavioral concerns and there's a plan in place, and we can monitor that for 90 days. So those are reasons why a 90-day plan may be implemented and used in our waiver. In the service plan development, you will begin what is new is a mini quarterly assessment. And that's going to be used with the case manager, where the case manager will meet with you on a quarterly basis, as I indicated before, and review with you your service plan to ensure your service plan continue to meet your needs, and then talk with you about other things that may present a risk for you, so that they can ensure your service plan continue to meet your needs, or if there's a need to update your service plan. And also what's new is electronic engagement with your case manager, where you will have the opportunity at your will to engage with the case manager in an electronic platform on your electronic platform system. That means that you can do some FaceTime with your case manager, Skyping with your case manager, doing scheduled quarterly visits. And that is truly at your approval and agreement. All right, so let's switch gears a little bit and talk about health, safety, and well-being, and the purpose of our health, safety, and well-being. This is not a huge program change for us, but we have incorporated some new elements within our health, safety, and well-being. So the purpose of our health, safety, and well-being is to ensure that you, as the waiver participant, that we're assuring at all times that your health and welfare is intact, and that we have an effective way to deliver our waiver services. And, I talked about that. The ensuring that you meet our clinical eligibility, that we're doing a thorough assessment to ensure that we know all your needs, so that we can create a service plan for you that address those needs in amount, frequency, and duration. And then we have those qualified providers who's rendering your services, and then your case manager having those routine, regular contacts with you to ensure that your services are being delivered and that they are being effectively delivered and meeting your needs. So our primary goal for our health, safety, and well-being is also to ensure that we have a management system in place to address any incidences that you may have. And then we're going to try to mitigate preventable incidences for you and to promote your health, safety, and well-being. So when we identify an incident, our goal is to identify why that incident may have happened and what can we do in the future to prevent similar incidences from happening. And we do that through, again, like I said, a person-centered care plan or a service plan, identification and monitoring of risk of abuse, neglect, and exploitation, individual planning for dignity of experience, mitigation of perceived unsafe living situations, planning for emergencies and disasters, and validation of provider qualifications. So I kind of sum that up again. We look at all those things to ensure your health, safety, and well-being. At the same time, allowing you as the waiver participant to make choices about how you want to live, how you want your services to be provided. So when we look at our health, safety, and well-being, we have to have minimum monitoring requirements in place. And our minimum monitoring requirements is we have to have a monthly contact with the beneficiary. Every month, through the duration of their participation, it must be monthly contact. And throughout that monthly contact, within a quarter, there must be a face-to-face visit. So I'll talk about the face-to-face in a minute, but I'll talk now about the monthly contact. So the monthly contact, it allows the case manager to monitor you on every calendar month other than your quarterly visit. And it just allows the case manager to talk with you to say, how are things going? How is your service provider rendering your services? Are there times when your service provider doesn't show up? The number of diapers that you're receiving, are they sufficient enough to meet your needs? Have you identified any other areas or services that you may need? Have you been in the hospital this month? So they're going to ask questions like that of you to determine, are you safe? Are the services that you're receiving meeting your needs? And that monitoring engagement can be by telephone. That's minimally. They can call you by phone, or they can make a home visit or have a face-to-face contact with you. And they will also talk with your service providers, your direct service providers that are listed on your service plan or your plan of care, and ask them those same questions. How frequently is the aide missing work, or are there concerns that your aide may have identified? Is the beneficiary or the waiver participant eating like they need to eat, or following their diet, or taking their prescriptions like they need to take their prescriptions? So they're asking these questions just to ensure that you're safe in the community and that your services are being met, your needs are being met through the services that we have created. Who are the participants in these monthly monitoring contacts? You, of course, the case manager, and your direct service providers. Again, the engagement can be by telephone. It can be by electronic exchanges when it's approved by you as the waiver participant. Okay, I think I got it going now. All right. So when we look at our minimum requirement for our quarterly contact, so the quarterly contact is just a monitoring contact that are intended to be conducted 4 times per year in collaborations with members of the multidisciplinary treatment team meeting. So if you're not physically able to participate in that monthly multidisciplinary treatment team meeting, your case manager must arrange a time to meet with you in your home or by electronic engagement. And the quarterly contact visits are scheduled in this fashion: October through December, January through March, April through June, and July through September. That means that in the month of October through December, either in October, November, or December, expect a quarterly contact with your case manager. And again, as I stated before, this is an agreement. Once you all sign the service plan and complete the service plan, you all will then agree to your quarterly contact visits. The quarterly contact visits will occur 4 times per year, and again, it can be by face-to-face, webinar, but it will be an agreement that your case manager and you will come to. For new applicants, when brand new applicants coming into our waiver, when the service plan is completed, it is mandatory for the case manager to do a home visit, face-to-face visit for the first quarter so that they can assure that the services listed in the service plan are meeting the needs as discussed in the initial assessment process. So on the level of care, we also have to ensure that when there's an incident, if you experience an incident, it is reported timely and immediately to your case manager. And your case manager will accept that information, complete a critical incident report in our ECAP system to document that incident for you. And we have two levels of incidences. We have a level 1 incidents. We have a level 1 and a level 2. And when there is a level 2 incident, it is a requirement for the case manager to do an investigation. And we call that a root cause analysis, not a major investigation. It's just an analysis of what happened and what can I do as a case manager and a waiver participant to ensure that this doesn't happen again or minimize the chances of that happening again. So this slide provides to you an overview of our level 1 incidents and our level 2 incidents. And a level 2 incident could be an accident by injury resulting in the need for medical care. It could be an emergency room visit that's not resulting in a hospitalization. It could be an inpatient psychiatric hospital visit. It could be a fall, death by natural causes, or failure to take your medication as prescribed. And we look at that, and if there's continue to be patterns of this, then when we want to identify why are these things happening and what can we do to mitigate or reduce the chances of these things happening. Is that a revision to the plan of care, adding additional services, or linking you to other services within the community? Our level 2 incidences, we call those kind of serious incidences that we need to stop and say what happened and how can we make sure that we're protecting your safe, that we have services in that's safeguarding your health. And those incidences are adult protective services referrals. So when someone makes a referral on your behalf to indicate that you may be abused, you may be being neglected, or you are being exploited, and we review those carefully. When there are injuries of unknown source, when there is a death other than expected, or when there are or by unnatural causes. When you are restrained or secluded because we are not able to provide services to beneficiaries. Beneficiaries, when they're participating in our program, should never be restrained or secluded. When we identify misappropriation of our consumer-directed funds, when there's a fall resulting in a hospitalization or death or traumatic injury, when treatment of medication errors are done and it results in injury or hospitalization, or when there's a missing person, homicide or suicide, or when there are media-related events. The little stars that you see, those little asterisk things, those are here to indicate when any one of these level 2 incidences occur that a root cause or an investigation is required. We need more information to identify why did this happen and what can we do in the future to prevent it from happening again or mitigating it, your risk. Okay, on the program changes, we have expanded our rights and responsibilities, meaning that we have updated our rights and responsibilities form for you. so that you can understand what your rights are as a waiver participant, what the rights are for NC Medicaid and your case managers, and then what is their responsibilities, what they have to do to ensure that you're receiving your services. So you will see that when you begin participating in this waiver program, in our new waiver, and also when it's time for your CNR, your annual assessment. So rights and responsibility, the purpose is just allowing or providing the waiver participant with a full understanding of your rights and responsibilities while participating in the waiver program. It is a written document that you will sign that clearly describes for you your rights and responsibilities. And it is a requirement that you sign that document so you can say, I fully understand what my rights are and my responsibilities. And it also includes the rights of participating with your case manager in those contact visits, providing the case manager the needed information he or she needs to complete the assessment and gather information during the monitoring visits, and complying with your service providers in order for them to carry out your service plan or your care plan. Failure to sign the rights and responsibility form may delay your service delivery. So if you fail to sign, it may postpone your waiver services until you sign the document. So rights and responsibility assurances. What you should expect as rights and responsibilities as a waiver participant. You should expect freedom of choice, meaning that you have the choice to select any qualified provider to render your services. And I talked about earlier how we identify who is qualified to render a waiver service. You have the right to request a fair hearing when an adverse decision is made. So if you request something that our waiver provides, and there's an adverse decision, meaning that we say no, or we terminate, or we reduce a service, you can request a fair hearing to grieve that service. You have the right to voice a concern or complaint or grievance and receive follow-up or acknowledgement. So a concern or a grievance is not you can't have a hearing or an appeal, but you can receive follow-up information, an acknowledgement that we hear your concern, your complaint, and grievance. You have the right to invite anyone you want to participate in your development of your service plan or your care plan. And you have the right to direct your care through consumer direction when you meet the competencies or when you have or can demonstrate the competencies to direct your care. You have the right to make changes to your service plan and care plan. You have the right to know when your scheduled care cannot be covered as listed in your care plan or your service plan. You have the right to know when there will be a substitute caregiver to provide your services. You have the right to know when someone is coming to your home to do a monitoring contact with you. So that is the agreement, as I stated, when your service plan is completed, the visiting schedule you and your case manager come to an agreement with. But also know, Medicaid does also have an ability to say that home visits can be made unannounced, and your case manager can conduct unannounced home visits when they are warranted. You have a right to know how to contact pertinent individuals, such as your direct service providers, your case managers. You should be provided their contact information. You have a right to have your services that are restraint-free and that you are not secluded when your services are being rendered. So those are your rights and responsibilities as a waiver participant. So I'm going to shift gears a little bit and talk about home and community-based services, the services that are included in our new renewal waiver application. And you will see services that you may be already familiar with, and then you will see some new services that are approved in this new waiver cycle. Again, this is a broad overview of these services. As you begin working with your case managers, and as your case managers receive the training, they can provide you more detailed information about the services that are approved in our new waiver. So adult day help service is a service that we have always carried in our waiver. It will continue. And it's just an organized program of services during the day in a community group setting in an adult day help center. Individuals who are appropriate or eligible for that service is that they need appropriate day supports and who need a structured day program of activities and services with nursing supervision. So these individuals may need some supervision, may need a day program that is structured. So the limitations for this service is that 4 hours is minimum per day, and it must be scheduled for 1 or more days per week. So that's the minimum. Minimum is 4 hours per day. You can go up to 5 days a week, but if you go 1 day or any 1 day, it can't be less than 4 hours, and you can receive the service 1 to 5 days per week. Our other service is CAP in-home aid services. And that service is not a new service to our waiver. You will begin hearing us call it CAP in-home aid. We may have called it in-home aid or personal care before in our other waivers. Excuse me, the phone. But in this waiver, you will hear us call it as CAP in-home aid services. And these services are just hands-on services that provides assistance with activities of daily living and basic home management tasks. In order to be eligible for this service, you must need hands-on assistance for 2 or more of the 7 activities of daily living that we assure in our waiver, such as bathing, dressing, eating, toileting, hygiene, mobility, and transfer. And also assistance with key IADLs to meet your needs. Limitations here, you must need the services that are rendered by a CNA 1 or a CNA 2, and the hours of in-home services is based on your need, based on what information that's provided during the assessment. That is how we determine need for these services. And CAP in-home aid services is not intended to provide 24-hour care to the beneficiary. It allows the supplement or the informal caregiver system to meet your activities of daily needs. A service that's new, the name is new and different. It's called Equipment Modification and Technology. You may remember that service in our old waiver as home modification or home accessibility and adaptation. What you will begin to see in this new waiver, you will see us referencing those items as equipment modification and technology. And it's just simply equipment, physical adaptation, minor modification, product system, devices, supplies, monitoring systems, specialized accessibility and adaptation, or safety adaptations that will be provided in the home or the vehicle to ensure your safety or accessibility to those things. In order to be eligible for equipment modification and technology, that you must need improvement or modification or enhancement of your mobility, your safety, and independence and environment in order to be able to have access to the community. The limitation to this service is $13,000 over 5 years. So it's $13,000 over the cycle or the approval of this waiver. So our waiver is approved from 2019 to 2024. So you can assess these equipment modification and technology throughout the duration of this 5-year period, but it cannot be over $13,000 total, and you must qualify and need these services to, again, improve your mobility, your safety, your independence, your environmental situation, or allow you to be able to access the community for pertinent things to meet your healthcare needs. Financial management services. It's a service that's used for consumer direction funds or management of the consumer direction funds. So if you are enrolled in consumer direction, you will be assigned a financial manager in order to be able to manage the funds for you. In order to qualify for this service, you must complete a self-assessment questionnaire, and the self-assessment questionnaire identifies your ability and willingness to self-direct. And you must be approved. The limitation is you must be approved to direct your care in order to receive a financial manager. Meal preparation and delivery. That service is not changed. It's just a definition is a nutritious meal. Some of these meals on wheels. And in order to qualify for that service, you must require special assistance with nutritional planning. And the limitation of that service is you can only receive 1 meal per day. So you can receive meals 5 days a week, but you can only receive 1 meal per day. Personal assistance services, that service is only for individuals who are directing their care, and it's a hands-on assistant with activities of daily living and basic home management tasks. And in order to be eligible for that service, you must need hands-on assistant and or assistant with your IADLs, instrumental activities of daily living. And the limitation to this service, the personal assistant, must pass a background check, must demonstrate their competencies in order to provide those services, and must sign an employer-employee agreement. Personal emergency response service is a service that's not new to our waiver. It is a service that provides emergency response. And the eligibility for this service is usually for individuals who live alone and need that ability to have someone to respond quickly when there's an emergency. Or the person has physical limitations. The limitation of this service is 1 emergency pendant, and that the installation and maintenance fees are not covered. Specialized medical supplies. You may remember this as being specialized medical equipment and supplies. And this new waiver, you will hear us to call it only specialized medical supplies. And under our specialized medical supplies, we will cover oral nutritional supplements. Those are those supplements such as Ensure, Boost, Glucerna. We will also cover specialized incontinence supplies, such as liners and reusable pads. And we will also cover medication dispensing boxes when it's needed. to be eligible for these specialized medical supplies, a physician must order or prescribe the need for or order the need for these supplies, except the dispensing box. The case manager can make an assessment that the waiver participant may need a dispensing box, and that will not require a prescription. But a prescription will be required for the oral nutritional supplements and those specialized incontinence supplies. And the limitation for this service is truly the amount prescribed by the physician. So the physician will then determine the frequency and the amount of these supplies for the waiver participant. Goods and services. So what you will see in this waiver, you will hear us reference our participant goods and services. You may be familiar with that term. You will hear us reference that now only as goods and services. But under goods and services, there are a number of goods and services that you may have access to. We will have individual directed goods and services and participant goods and services. Those services are for items that are needed to assist with your activities of daily living and instrumental activities of daily living. So we will have a list of items that we have identified that may be needed by a physically and aged individual while they are participating in our waiver. Also under goods and services, we have a new service, and we've covered this before, but we have a separate service name for it, and we call that pest eradication. So if you need assistance with eradicating pests from your home, you can access goods and services. We have a goods and services called non-emergency transportation for community transportation. We have a goods and services for nutrition services. And that's for prescribed over-the-counter and supplements. And the supplements doesn't include the oral nutritional supplements. These are herbal supplements that is prescribed by a physician, but Medicaid pharmacy will not cover those items. And it must be determined medically necessary and approved for you to receive those services. And we have another service called declutter and garbage disposal. And to be eligible for these services, you must need it. There must be an assessment of need for any one of these goods and services, and that you do not have the financial means or your family members to be able to acquire or obtain those services. And the service will meet or maintain your health, safety, and well-being. The limitation for these goods and services is $800 every July through June, through the 5-year waiver approval period. And that's $800 collectively for all these items. So if you, say for an example, if you have pest eradication and then you need a declutter service, the pest eradication and the declutter service cannot exceed the $800 from July through June. Training and education, it's not a new service. It's been a part of our waiver, and it's intended to provide training, orientation, and treatment to the beneficiary and the waiver participant and the family members to learn more about the nature of their illness or disability and how to better manage it. To be eligible for that service, you just need more enhancements on decision-making about the disease so that you can be able to independently care for yourself. Or if it's training to the family member, it allows the family member to learn more information about the beneficiary so that they can be able to care for the beneficiary more efficiently. And the limitation on that service is $500 from July through June. And it would have to be something, a training that is directly related to your disability, physical limitations, and it must ensure that you are able to then independently care for yourself, or that your caregiver who is caring for you are provided more efficient ways of managing your needs. Respite is not a new service for us, and it allows just temporary relief from caregiving. And in order to receive respite, you must be enrolled in the CAPDA's program. And the limitation on that service is 720 hours from July through June. Community transition services is not new to our waiver. But it's a service that allows you to obtain goods and services to assist with moving back to the community from a nursing facility or institutional placement. And to be eligible for this service, you must have been in an institution 90 or more days and planning to transition home or to a home placement. And this service is different from Money Follows a Person. If you're familiar with that, it's similar, but it is a little different than Money Follows a Person. And the limitation to this service is that you must have goods and services within our package that aids in the transition, setting you up into your new environment. And the maximum amount is $2,500 that you can use for setup fees for the first year of your community living from the transition from a facility. A new service for us is community integration. And that service is intended to provide you goods and services to address any tendency-related issues. In order to be eligible for that, you must be enrolled in the CAPDA's waiver. And there is limitations in terms of the amount, $2,500 per enrollment in the program. And it does not pay for room and board or back rent or, it will not pay for that, ongoing rent. It is in combination with community transition. So if you're a new beneficiary transitioning into our waiver and you access our community transition, and then you experience tendency-related issues and you want to access community integration, you can do that. But the collective amount is $2,500 over the 5-year period of the waiver, 2019 through 2024. Coordinated caregiving is a new service for our waiver, and we will have more sessions and discussions about that so that you understand and know how that service works. Coordinated caregiving is just a shared living environment for a waiver participant. It allows the waiver participant to move into someone's home or allow someone to move into the waiver participant's home to allow that person to provide life skills to the waiver participant and assist the waiver participants with their activities of daily living and their instrumental activities of daily living. To be eligible, you must be enrolled in the CAPDA's program, and you must select or willingly accept that shared living environment. If you participate in that program, there are limitations to other services that you can receive, such as Meals on Wheels, because the person who's sharing a living environment with you should be able to prepare the meals for you. In-home aid, that shared individual, the person who's living in your space or you're living in their space should be providing the assistance with activities of daily living, emergency response, and then respite. So those are our waiver services, and you'll begin to see those those new services, and your case manager will begin talking with you about those services as they begin their monthly contact with you and when you go through your annual assessment. So I'm going to switch gears now and talk about consumer direction. I know consumer direction is a service that we implemented in our program, I believe in 2005, and we have been providing that service consistently through that time. We have identified that to be a very a good service for a beneficial service rather for our beneficiaries, because they're able to hire whom they want and ensure that the workers are meeting their needs. In order to be eligible for consumer direction, you must meet some just basic requirements. Anyone is eligible to consumer direct. And the way we determine eligibility for consumer direction is that you must complete a self-assessment questionnaire. And from that self-assessment questionnaire, there is evidence that you are willing to direct your care and you have the ability to direct that care. Meaning that you understand what the process is, you know how to write care plans, you know how to manage your staff, you know what your needs are, so that you can tell others how to meet your needs. You must complete an orientation training to understand consumer direction in the CAP-DA's program. You must be able and willing to complete competency validation forms for the individuals you're planning to hire. You must sign an employer agreement form and also an employer-employee agreement form, and that will be initiated by your financial manager. Who can be paid? Anyone can be paid who passes a background check, which consists of a criminal and health registry check. And it's not usually a power of attorney or health power of attorney or legal guardian, because those individuals are making decisions on your behalf. And when they're making those decisions on your behalf, they can't be paid to make those decisions and render the care. Now, there are some times when those a PA or HPA can be the paid caregiver, but that's something that you will work with your case manager about, and that may be the appointment of a paid representative to direct the care. What are the requirements if you are going to participate in consumer direction? You must act as employee of record, meaning that you are in charge of your care plan, that you are making these critical decisions with the support of your case manager, that we call care advisor. That you are managing your staff, you are ensuring that your staff they are meeting your needs and reporting to work timely. You are participating in monthly monitoring contacts, keeping your case manager informed of any changes. You are completing quarterly reviews on your hired workers. You are reporting critical incidences to your case manager, and that you are aware of fraud, waste, and abuse, and reporting the incidences of fraud, waste, and abuse when you experience them or know about them. So those are the requirements or the changes for consumer direction. So in our new requirement, we receive a number of questions about who can provide the hands-on care and get paid. In this waiver application, individuals who are 18 years old and older, they can provide personal care services and personal assistance services when they meet the hiring qualifications based on your assessed needs and the hiring agency or employer. So, if you are receiving CAP in-home aid services, our requirement is that you be a CNA, a 1 or CNA 2. And if you meet the basic requirements of that organization and there's a nurse signing off on that, then it's potential that you can be hired. You must pass a background check. What is new in our waiver, and it's not new, but what we have outlined in our waiver is will be circumstances where, or situations rather, where a legal guardian may be paid to provide hands-on care to their waiver participants. And when that is indicated, the legal guardian must fall, or the person must fall into the exception category under extraordinary conditions or circumstances. And there's a list of things that falls under extraordinary circumstances where a legal guardian may be paid to provide those hands-on services. When those situations arise, we will arrange for the beneficiary to be in a coordinated caregiving support role so that there is oversight of the services, the hands-on services that's being provided to the waiver participant. So our waiver approval period. Our waiver will become effective November 1, 2019. So you will begin hearing the case managers talk to you about new processes and new requirements. You will begin seeing our new policy on our website if you ever visit our website. You will begin seeing new notices in the mail after November 1 when you need a new notice about any decisions we make regarding your care. So our waiver goes for 5 years. We're approved to provide these services within a 5-year span. And our waiver year 1 is November 1, 2019 through October 31, 2020. Our waiver year 2 is November 2020 through October 31, 2021. Our waiver year 3 is November 2021 through October 31, 2022. And our waiver year 4 is November 1, 2022 through October 31, 2023. And our waiver year 5 is November 1, 2023 through October 31, 2024. So our waiver will remain as is written or being approved throughout this waiver cycle unless that there are some changes that we make to the waiver application, and then we submit a revised or an amended waiver to make those changes. But if that ever happens, we will talk with our stakeholders, our waiver beneficiaries, to inform them that we are planning to make some changes and seek your comments and advice towards those changes. Also, what you will begin to see is different our program definitions so that you can truly understand what those definitions are and how that relates to you as a waiver participant. So you will see these definitions, and your case managers can also share these definitions with you as well. Okay. All right, so I know I talked a lot, and I talked about an hour and a half now. I will pause here and see if there are any questions. And if there are questions, I will try to address the questions to my ability. And if you prefer to verbally state your question, if you're not able to write, type it in. You can always raise your hand, and we can unmute your line for you to ask your question. Again, the questions should be about the amended, the changes to the waiver, not specific personal participation or your experience in the waiver. Okay. So I'll begin at the top. Let me take a drink of water a minute here. Someone asked, can information be provided to the CAP beneficiaries about managed Medicaid transformation? Yes, we are providing information to all Medicaid beneficiaries about managed care and Medicaid transformation. So if anyone is receiving Medicaid, they should receive information about Medicaid transformation and how that impacts them. Individuals who are participating in our CAP DA waiver are excluded from managed care when it rolls out in February 2020. We're excluded from managed care until year 4 of when we roll into managed care. So all Medicaid beneficiaries are receiving information about their participation for Medicaid transformation. Someone asked, does every participant have a case manager? Yes. Every CAP DA beneficiary will be assigned a case manager. In order for you to, one of the requirements to participate in our waiver is that you have a case manager to monitor your care needs and keep you linked to services in the community and to just ensure your health, safety, and well-being. So yes, every beneficiary will have a case manager. Since for a CNR, will a case manager have to make 3 home visits, 1 for the assessment, 1 to develop the service plan, and 1 for CNR, for the monitoring contacts, there must be 4 visits in that monitoring, 4 scheduled quarterly face-to-face visits throughout the duration of the waiver participation year. And 1 must be during the time that the annual assessment is completed, and the other visits, 1 or 2 of the other visits must be face-to-face. Or someone says, can you explain again what coordinated caregiving is and who does that? Would that fall under managed care, case management? Coordinated caregiving is a new service for us, and it's a shared living service that allows a beneficiary to move into someone else's home to receive the life skills they need, along with the assistance with activities of daily living, or it allows someone to move into that beneficiary's home. It does not fall under managed care, but a case manager will provide oversight, and there will be an organization that is assigned to create a care plan and provide support and assistance to the person who is living with the CAP beneficiary.
What?
Someone asks, is the emergency and disaster plan something that the provider needs to give case managers, or does the patient provide that to case manager? Right. It is a document that the case managers will assist the waiver participant to complete. And once the emergency and disaster plan is completed, then the case manager will take that information and then provide the waiver participant a copy of that, so that the waiver participant can share that copy with their providers. They can post it somewhere in their home, so if there's a need for an emergency, someone can come in the home and see it in a prominent place and carry out what the emergency plan should be. Someone asked, it used to be the CAP aid could be a non-certified aid if the beneficiary did not require CNA. That's still the case. We've not changed that at all. The in-home aid provider organization must determine who is qualified to render that service. They follow their own guidelines in terms of health services regulations, as well as the Board of Nursing. Someone asked, is there an ombudsman's program for CAP DA? And currently, we don't have one specific specifically for CAPDA, under managed care, we are looking into creating an ombudsman's program, and hopefully once that is created, we will use those services. We don't have an ombudsman's program, but we all are in the process of procuring an independent assessment entity that will help manage concerns for us and direct them to where they need to go. Someone asked that the family or the family doesn't have financial means to help with the cost of goods and services. Where does the waiver say that? It says that in Section C of the waiver. If you go to Appendix C, C1 of the waiver, and each one of the waiver services, it will identify that when the family member doesn't have the financial means to render those services. You will see that in our clinical coverage policy as well. Someone asked, can we give examples of tendency issues? There's so many examples of tendency issues. I prefer not to give an example in this platform because everybody's situation is different, and usually what I find is when I give a specific example, people take that and not fully understand particular situations. So it is person-centered. It says, if a change with the freedom of choice sign form, will the case manager need to make a face-to-face visit within 2 days? I'm not sure exactly what you're asking here. What I think I said in terms of the 2 days is that once the beneficiary, once the case manager is selected, or selected to do the service plan, they should make contact within 2 days to the beneficiary. Just make contact, and that can be by phone, to say, I accepted you selected me as your case management entity. Let's plan a time for me to come out to your home to complete your service plan. That's what that means, just making contact to arrange that first visit. Someone says, does a beneficiary need to experience a problem before accessing community integration funds, or can the beneficiary and their family guardian be proactive to assess these funds to prevent problems that put the person at risk? I know we always are in reactive mode, but usually this service is for if something is happening, then we can mitigate that. So if there's something that the case manager has assessed and it is a personal goal and it can maintain their community placement, it's possible it can be planned proactively. But usually this is a reactive service. But yes, if it's something that's clearly outlined, it addresses a immediate concern that was identified during the assessment, it can be identified in the person-centered service plan and used towards a goal and can potentially be assessed using that service. Says, will my case manager complete my disaster plan? The emergency and disaster plan should be completed by the waiver beneficiary or their caregiver or formal support system. The case manager is there to support you in the completion of that form, to ensure that it's comprehensive, that when someone picks up that form, they know what your emergency contacts, who your emergency contacts are, how to carry out your health care needs. If you or your primary caregiver is not able to verbalize that, and then what to do in an emergency. If there's an ice storm and you need emergency services to come to your home, they can pick up that document and know exactly what to do to carry out your health care needs. Someone asked about the in-homemade for CAP, CNA 1 and CNA 2. What we're saying here is in order for beneficiaries to receive CAP in-homemade services, their needs must be consistent with aid certified assistants that are NA1 or NA2. But when the in-homemade agency assigns the worker, they follow their guidelines, the Board of Nursing guidelines, Health Services Regulation guidelines. So if they are able to make different decisions based on their own guidelines, our waiver allows that to happen. It says, is consumer direction different than personal assistance? Consumer direction is a service that allows the beneficiary to direct their care. And under consumer direction, the hired worker is called a personal assistant. For beneficiaries and family supports that are not able to watch or hear this information, is there hard copies of the presentation available to be mailed or hand-delivered to them? Certainly. We will provide the waiver beneficiary information for you to share with them. Can a coordinated caregiver be the POA or guardian? Yes, that is possible. And as I indicated before, if we have a POA or guardian that we identify to be under that extraordinary circumstance, then our process or plan is to or arrange for the coordinated caregiving so that we can have oversight that they're doing or carrying out the plan as indicated. Someone is again asking about how the visits are carried out. We will provide more information to the case managers about how they will carry out visits. We had orientation training with our case managers to provide them an orientation of how these things work. We will have a training in the service plan and monitoring that provides information to the case manager. Someone says, I wanted to know where I can obtain training on direct service providers. In-home aid since missed the training held on October the 16th as did not see notice on time. Appreciate. Okay. If you are a direct service provider, you must enroll to be an ECAP user. And the training that I provided for the direct service providers will be available on the ECAP web page. So you can access that information there. That information should be available for direct service providers on or before November 1 at the effective date of our waiver. Says, can a family member provide direct care services for a participant without having a CNA or CNA 2? As I indicated before, who can provide the services? Let's see if I can find it again. I said that anyone can provide the service who are 18 years and older, meets the hiring qualifications based on need, and passes the background check. And then if you fall into one of those extraordinary circumstances, you could potentially be provide the care. So we don't put limitations on family members. The only limitations we put is that if you are a power of attorney or guardian or health power of attorney, we have other ways that we have to look at that, because we have to ensure that if you're making the primary decisions for that beneficiary, that we're protecting the interests of the beneficiary. So that's the only requirement that we have. Says, will the new waiver require van modification for adults? It will allow modifications to vehicles. The amount that we have for modifications is $13,000. So it may not modify a full van, but it may make some modifications like adjustments to the van, a lift chair, a lift to carry the wheelchair, some adaptations to the steering. So it may make those modifications, but it's not going to fully modify a van or a vehicle. Someone says, does the nursing facility honor respite services? They do. We have institutional respite and non-institutional respite. We have institutional respite is respite that a beneficiary can go into a facility to receive those services. And then we have in-home respite where the respite is provided in the beneficiary's home. Someone asks, emergency disaster plans are completed at the assessment and then 2 other times during the year, and the plans are uploaded. Yes, the emergency plan should be completed annually, should be completed initially when a person is new into our waiver, updated 2 times a year, and then it's completed again annually. So it's completed initially, annually, and then updated 2 times per year. Since when will the state make new coordinated caregiving service available to the beneficiaries? Will it be later than November 1 start date of the waiver? That is the plan. Our goal is to provide more training and education to our beneficiaries about the coordinated caregiver, invite providers in to talk about coordinated caregiving and assist them in enrolling to be providers for coordinated caregiving. So I would say that more than likely that service will not start on November 1. It will be available, but it will not start on November 1 because we don't have any qualified providers to render that service yet. We have to get them qualified, ensure that they meet all of our qualifications, provide more information about how that service should be rendered, and also provide more training to our beneficiaries and providers about that service. So we will have in November, early part of November, a orientation session with providers who's interested in providing coordinated caregiving, and then we will then have an open enrollment period for them to enroll as Medicaid providers if they're not already enrolled, and then doing that managed change request to add that to their service enrollment package. Someone asks, if an emergency arises and the caregiver isn't available, can I use a, if that's how you create your emergency plan, that's perfectly okay. You will be the individual in charge of your disaster and emergency plan and what meets your needs. Someone says, C1 says responsible party, not family. I think you are being misleading in saying the family resources should pay for goods and services before the waiver. Okay. There's a question about a legal guardian again. We have clear guidelines about the legal guardian requirements, and in order for us to ensure that we provide oversight of legal guardians who are making the legal decisions for our beneficiaries, as well as providing or carrying out the care plan and getting paid, one of our requirements that we're saying is that we are going to enroll them as in coordinated caregiving. When that's not an option for them, then we will have other strategies in place to meet the beneficiary's needs. and the waiver participant. Someone asked, do we have hard copies in Spanish? We do not. In our waiver requirements, we do have to ensure that our participants have access who may have English may not be their first language, and we have special guidelines as to what things that we have to convert into Spanish, and that includes our enrollment forms, our assessment forms, and so those are the things that we are obligated to provide for individuals that are not English speaking. It is the case manager's responsibility to ensure that they have a way to communicate with those individuals. Someone asked about, can respite be provided? Respite can be provided. Respite is a service that is available to our beneficiaries. If a beneficiary needs respite service and there is a need, identified need in a plan that has those person-centered goals, they should be able to receive those services. Someone says, does the CAP case coordinator have a list of those nursing facilities that accept respite? They should, or they may, or they can identify. What they would have to do is just talk with providers in their community and see what services they're interested in providing. And then once they identify the services they're interested in providing, they will add those providers to their freedom of choice list. That's a document that they keep that identifies providers who are willing to render specific waiver services in the community. All right, so it looks like all the questions in the chat box. Okay. I want to thank you all for participating in today's webinar. Again, this slide will be made available to the case managers to share with our waiver beneficiaries if they prefer or ask for it. It will include information or it will be updated to include information about the questions that you posed today during this webinar. It will also include FAQs for you to be able to refer to frequently asked questions. Okay, if you have any additional information or if you're seeking any additional information, please feel free to reach out to any one of our case management entities or your case managers, and they will provide you additional information that you may need. All right, again, I want to say thank you for participating in today's webinar. I hope you all have a great day. Thank you. Bye-bye.